Hospice is Hope is sponsored by Methodist Hospice, where the end of life doesn't have to mean the end of living. In the face of life-limiting illness, Methodist Hospice provides comprehensive care and compassion to patients and their families. Methodist Hospice helps patients to retain their dignity while also focusing on their social, emotional, and spiritual needs. More information can be found at www.methodisthealth.org or 901-516-1600. Methodist Healthcare, embracing the miracle of life.
Hello and welcome again to our series Hospice is Hope. In today's installment, we're going to be looking into exciting developments in Shelby County where patients are taking charge and becoming actively engaged in their health care by discussing with their clinicians and family members the direction that they want their health care to take. We're joined by experts in health care today, Sally Aldrich, Deborah Bartelli, Kathy Huff, and a family member, Willie Love. We'll be sharing their perspectives with you in terms of how advanced care directives can be such an important and integral part of making sure that your wishes are known as you travel through the health and illness trajectory. Welcome, Sally.
Thank you. Nice to be here.
And Deborah.
Thanks.
We're so thankful that you two have joined us today. And I'd like to share with our viewership today your role. Sally, you are the administrator for Methodist Home Health and Hospice.
I am in palliative services. It's a great honor to work for Methodist Healthcare and provide that for them.
Wonderful. Deborah, you're with the Healthy Shelby initiative. Tell me a little bit about that initiative. You're the director. Tell me a little bit about the work that you do here in Shelby County in helping patients and families.
Okay. Well, Healthy Shelby is a relatively new initiative in Shelby County. It's a multi-sector public-private initiative that includes our healthcare delivery system, the faith community, the business community, the philanthropical community, and relevant social services, as well as our city and county governments. And we've all come together to work collaboratively to achieve what is called the triple aim. And that triple aim is to improve our population's health, to improve the delivery of health care, and to do it all at a lower cost of care.
That's fantastic. Now, as I understand it, the triple aim, as the name would imply, you basically have three goals. Mm-hmm. What are those three areas on which the Healthy Shelby initiative is working?
Well, we're working in areas that really we felt the community already had some work that was ongoing, okay, that people were interested in, that really drove our healthcare costs, but also where there was a lot of need for improving quality of life for people. And those three areas are our high rate of infant mortality, chronic disease management in our community, and end-of-life care. So those are the three areas that we're focused on.
Now we know that in the Shelby County area we rank rather poorly compared to the rest of the nation with infant mortality. Mm-hmm. I'm also aware that we are a hotbed, if you will, for diabetes, mm-hmm, for cholesterol problems and stroke. So the chronic disease, mm-hmm, management issue speaks to diabetes and hypertension and lipid management or right, cholesterol management. Mm-hmm. But tell us a little more about end of life. Certainly Sally and I have some experience in that area. So what are the reasons that our community leaders, be they governmental or business or healthcare administrators, why did our business leaders and community leaders say we need to take a look at end of life care? What were some of the challenges, mm-hmm, that you guys saw? Because Sally and I certainly have our clinical perspective, mm-hmm, but in terms of the broader community, what are some challenges that we face in Shelby County?
Mm-hmm. Well, in all three of those areas, we looked at the data. And when we looked at end-of-life care, we saw that Shelby County has one of the highest intensity rates for care during the last 6 months of life. That means many people are getting a lot of care that may not, and in most cases does not, improve the quality of life or lead to positive outcomes at the end of life.
Mm-hmm. Sally, how could somebody get care that doesn't improve quality? I mean, isn't it all about access to care? How could somebody in the end of life receive more care and yet they don't get good quality? How does that happen?
Well, it happens really when dying patients get caught up sort of in the health stream machine, so to speak, and they lose advocacy, they lose a voice. And one of the things that we see in our end of care when we're doing hospice is that so many patients and families come to us with so little time left because they've really not been informed, they've not been educated about what their choices could be, and they come to us very late in the illness trajectory. So that was sort of the goal when we were, when we all came together as part of the Healthy Shelby project. We had people from all over Memphis, from different hospital systems, Baptist, Methodist, St. Francis, now the Med, and then different faith groups, the Church Health Center, lots and lots of different interested parties all came together as part of Healthy Shelby, and we began to talk about this. What does good end-of-life care look like? How do we get there as a county? And that's when we talked and talked and talked, many, many, many meetings, and we finally said a lot of it comes down to the patient's ability to have a voice and to direct their care. And that's when we began to look at the advanced care planning. It's really not about how we deal with life right at the end of life. It's how do we deal with life as it leads up to the end of life.
Okay.
How can the patient and family be informed? How can they have a choice? How can we make sure that we do what that patient wants? And that's really what the group started to focus on.
One of the things that I saw as a medical student 20 years ago that really hasn't become resolved in the last 2 decades of my practice. So I would often round on patients in the hospital, and it wasn't really clear to me who was making the choices. So it sounds a little mystical, but there seemed to be a system or a machine. I call it the technological imperative, which means we have this technology, so it's going to be used.
Right.
I've come to appreciate in my career what I would like to call the clinical imperative, which means we have all types of care, but we should use those types of care if and only if they contribute to the patient's quality of life.
And if it's what the patient truly desires.
Absolutely.
And that I think is the whole crux of it.
To give a common example, the overwhelming majority of Americans prefer to die in their homes. 80 to 85%, depending on the community that's surveyed, will say, I want to pass peacefully at home. In fact, only about 20 to 25% of Americans do die at home. So many of them die in long-term care facilities or in hospitals. So we're providing care, and to your point, Deborah, it's very expensive care, but it doesn't match the patient goals. What are some ways that Healthy Shelby has looked at that we might change this dynamic where, you know, rather than just the healthcare system being a pinball machine and the patient is the pinball, and they just bounce around from system to system and person to person, machine to machine, how do we change that and take proactive, positive steps to ensure patients' wishes are carried out?
Well, I'm a data person, so I have to go back to the data. When we started this project, we looked at our hospital data. So we looked across our hospitals, and we saw that only about 22% of patients who are admitted to our hospitals have an advance directive.
Okay.
So have already started thinking about what they want.
Now, an advance directive means what?
It means choosing the kind of care that you want. It's a living will, is maybe a term that's more familiar with people. And only 1 out of 5 had that when they were admitted to the hospital. And so our goal, we looked at models in other cities, and we found La Crosse, Wisconsin, about 90 to 95% of patients admitted to their hospitals have an advance directive. And their cost of care in the last 6 months of life is among the lowest in the country. People are going into hospice, they're getting palliative care, they're dying in their homes, they're not in the intensive care unit during the last 6 months of their life.
And their satisfaction rates are higher.
Very high.
So their satisfaction with the health system is higher. It's not about people being denied care. It's about patients and families being informed and being able to choose what kind of care they want to have.
So you're telling me for less cost, we can get more quality if we just more closely align patients' wishes with the care they receive.
And that's where advanced care planning comes in. You've heard the term living will, you hear the term advanced directive, you hear the term advanced care planning. You know, we like to use the broad term of life planning. It's a way for families to really plan and patients to plan how they want to live their life. And the tool that they used in La Crosse is a tool called 5 Wishes.
Okay.
And that's sort of what we began to embrace in Healthy Shelby. It's a very lay-friendly tool. It's not written in medical jargon. It's more conversational, and it centers around 5 distinct wishes, what a patient would wish for their care.
Okay. In our following 2 segments, we're going to take a look at the impact of the 5 wishes on an individual family, and then on a practicing clinician in terms of her perspective, as Kathy Huff shares with us what it's like to see patients and families who have a 5 wishes document in place. A closing question for you, Deborah. I'm going to make you queen of the world for a day, and you can change end-of-life care in Shelby County any way that you want. How will it be changed? What's the one thing you'd like to see us as a community engender as we move forward?
You know, I think to have a more educated community so that people feel that they are in charge of what happens to them, no matter what stage they are, whether it's in managing their own chronic illness or in managing their last days of life.
It's just really about empowering patients, isn't it, and families?
Very much so.
All right. Thank you, Sally. Thank you, Deborah, for joining us.
Thanks.
We're going to be joined now in our next segment by Willie Love, who's a family member who will share with us how 5 Wishes and Advanced Directive offered her family dignity and peace during a difficult illness.